The wife of the president, Mrs. Aisha Buhari, has underscored the need for awareness creation on fight against cancer in African countries to promote detection and treatment. Mrs. Buhari, represented at the event by Dr. Hajo Sani, her senior special assistant on administration, gave the advice in her address at the 2019 edition of the Walk Away Cancer Awareness Campaign organized by Medic Aid Cancer Foundation, a non-governmental organization in Abuja. According to her, awareness against cancer disease in other parts of Africa has become imperative to promote early detection and treatment of the disease.
We are here to actually walk cancer out of Nigeria. And every woman, girl, men inclusive, must also be well informed about cancer and to know how they can do whatever they can do possible to prevent cancer, not only for themselves and for the country as well. We stand to compete with any other African country that will also form something similar to compete with them. And we are sure of actually beating any country in Africa. We have already taken the step. You know, the awareness is more important. They say prevention is better than cure. So I believe that as the news gets down to any other person in this country, I think it's a great achievement for us.
For her part, Dr. Zainab Bagudil, founder of Medic Aid Cancer Foundation, said for there to be effective control of cancer in Nigeria, state government must key into the fight against cancer, adding that Nigeria needs to start doing things at global level.
If we're really going to get effective control of cancer in Nigeria, we have to come down to the state level. So it's important that each and every state starts to look at it at their own level. And to start with, a screening program has to be instituted. The federal government has a national screening program. For almost everything, we have a plan. But to implement it is where the problem comes. And that is because we have to break the country down into pieces from the states to the local governments. So if the state governments can on their own start screening at the local government level, start giving these vaccinations to girls, we can eliminate cervical cancer by giving school girls the vaccination. There are countries in Africa that are doing it already. Nigeria has the resources to. It is the political will that we need to introduce at the state level.
In his address, Dr. Femi Ogunremi, Managing Director of Monitor Healthcare Limited, said breast cancer remained a major disease affecting women and girls in particular in the country, and that if not detected and treated early, it could lead to death.
Obviously, there's an issue around breast cancer in Nigeria today. Let's look at a situation where we look at the next 10 patients to be diagnosed with breast cancer and we follow them for the next 5 years. Only one or none of them will be alive. Okay? If you go to developed countries like UK, America, Canada, you do the same thing. You realize that about 9 or the whole 10 will be alive. So there's a lot of issue in Nigeria. And the issue that I think is it's around the fact that we don't screen our ladies. So a lot of ladies are, they're presenting too late. When the lady presents, it's too late. They come with fungating cancer